Have you ever found yourself beside Eva, your beloved, in the stillness of night? She turns away quietly, her sigh more telling than spoken words. You believe you've done enough, that your efforts are substantial. Yet, underneath, there is a tranquility so deep it borders on apathy, a place in her heart untouched. This, Robert realized after decades of marriage, is the hidden void that so many men in Europe share. Welcome to a revelation that Dr. Lauren Pierce, renowned medical sexologist and intimacy psychologist, brings today. Prepare to see the science of couples' intimacy with new eyes, not as a dance of strength or haste, but as a subtle, clinical symphony that unlocks both body and mind. For too long, men like George from Germany and Victor from France have lived under a veil of misunderstanding. They relied on vigor, velocity, and youthful force, missing the deeper needs of a woman's anatomy and neuropsychology. As couples transition into middle age, female fulfillment migrates from surface-based stimulation to yearning for deep resonance. The neurophysiology of sexual arousal is a symphony orchestrated by sensory nerves, pelvic vascular perfusion, the limbic system, and autonomic pathways. The key is not G-spot stimulation, but precision activation of the anterior fornix, a locus intimately embedded in the anterior vaginal wall just beneath the cervix. Dr. Lauren Pierce has clinically mapped this main power switch, connecting it to the pelvic autonomic plexus and, by extension, the emotional centers of the brain. When activated, the response is not merely localized, the entire body trembles as if swept by an electric current. Heart rate and blood flow surge, oxytocin floods, and transformational bonding occurs. This is known in recent sexual medicine as the uterine orgasm, a full-bodied, sustained pleasure experience, integrating both physical and psychological fulfillment. Yet, most European men have neither heard of this region nor acquired the dexterity for its activation. Now, Dr. Lauren Pierce's revolutionary Three-Phase Neuro-Pelvic Strategy comes into play. Let's delineate it clinically, step by step. First, the anatomical localization phase. Ensure Eva is supine on a comfortable clinical surface or bed, knees flexed to relax pelvic musculature. Glove up, lubricate your index and middle fingers generously, and insert gently along the anterior vaginal wall, palm upwards. Use anatomical guidance. The anterior fornix is approximately 5 to 8 cm from the introitus, situated superiorly and posterior to the cervix. Flex your fingertips upwards, exploring until you feel a spongy, subtly resilient tissue. Distinct from surrounding vaginal walls, akin to touching a ripe persimmon. This region is rich in connective tissue and neural dendrites. Approach with utmost delicacy, as rough friction induces nociception and emotional withdrawal. Second, the autonomic pressure phase. Apply steady, uniform pressure with the finger pads, holding for 5 seconds, then releasing cyclically. This activates the hypogastric and pelvic splanchnic nerves, propagating pleasurable afferent signals to the central processing centers of the limbic system. Medical evidence suggests slow, rhythmic compression, akin to acupuncture techniques, maximizes dopamine and serotonin release, preparing the body for deeper intimacy. Monitor Eva's reactions. Physiological cues such as deep sighs or spontaneous pelvic rotation signal appropriate nerve engagement. Any stiffening or withdrawal mandates immediate adjustment of force. Recall, tissue sensitivity varies with hormonal and emotional state. Third, the neuromuscular synchronization phase. When Eva's pelvis involuntarily tilts toward your touch, synchronize your pressure and motion with her bodily rhythms. Clinical studies show that mirroring a partner's kinesiological cues enhances vagal tone and deepens psychological surrender. This is the moment when full-body resonance is achieved. Breathing deepens, muscular tension dissipates, and oxytocin-facilitated bonding becomes reality. You are not guiding, but partnering in a neuromuscular dialogue. Prolong this interplay, adjusting motion as Eva's body draws and withdraws, sustaining the dance as long as comfort persists. Dr. Lauren Pierce has documented profound testimonials from European couples. Let's explore some clinical case studies. Case Study 1, George, 62, Germany. After decades of conventional passion, George's relationship stagnated. Upon employing Dr. Pierce's anatomical techniques, he required several sessions to precisely localize the anterior fornix. Clinical persistence paid off. Anna, his wife, experienced her first full-body climactic tremor, holding him tightly through waves of oxytocin surges. Electrophysiological monitoring indicated synchronized cardiac and pelvic muscle rhythms, a phenomenon first described by Pierce's team in 2021. Anna later described the sensation as rediscovering womanhood after 40 years. Case Study 2. Victor and Elise, France. Victor, believing his strength had waned, learned that pelvic floor engagement, not brute force, was central to Eva's pleasure. Under guidance from Dr. Pierce, Victor adopted coordinated pelvic floor exercises, pompoir, auto-Kegel, and Kabadza methodologies, interspersed with anterior fornix stimulation. Elise transitioned from passive to active orchestration of the dance, leading to smiles Victor hadn't seen for 30 years. Clinical studies corroborate that pelvic floor muscle synchronization heightens vaginal pressure gradients, amplifies sensory nerve activation, and increases subjective pleasure ratings by more than 25%. Case Study 3. Stefan and Sofia, Poland. Stefan, overly cautious, feared causing discomfort. With meticulous anatomical focus, guided by Dr. Pierce's scanning techniques and real-time feedback, Stefan located the anterior fornix. Sophia's whispered encouragement, "Right there," unlocked decades of confidence for Stefan, transforming him from hesitant observer to courageous explorer of intimacy. Post-procedural surveys showed dramatic improvement in sexual satisfaction scores, FSFI questionnaire, at both 3 and 6-month follow-ups. Dr. Lauren Pierce's protocols expand beyond manual stimulation. Clinical interventions for women include pelvic floor muscle training by biofeedback devices, electrical stimulation therapy, and advanced techniques such as V-notes, vaginal natural orifice, transluminal endoscopic surgery. Recent randomized trials confirm V-notes does not impair sexual quality of life post-operatively and can even enhance pelvic vascularization, sustaining healthy tissue response for deeper pleasure. For women who report pain or dyspareunia, clinicians recommend personalized rehabilitation regimens, pressure sensitivity training, and when appropriate, local estrogen therapy to reverse vaginal atrophy. For partners, neuroscience-backed mindfulness and synchronized breathing can further enhance neurochemical rewards during intimacy. Dr. Pierce further encourages couples to use medical imaging, fMRI, and ultrasound to visualize and understand pelvic floor dynamics. Seeing is believing, and nothing empowers couples like scientific insight into their own bodies. Leading clinics across Europe now host intimate anatomy workshops for couples, combining education, demonstration, and hands-on learning. Many European men emerge transformed, not by strength, but by anatomical wisdom, emotional attunement, and clinical skill. As science advances, so too must our minds. Understanding the anterior fornix and its role in the neurophysiology of sexual arousal is not only the key to deeper pleasure, but the gateway to lasting emotional and relational fulfillment. If tonight, Eva turns quietly in the darkness, let that sigh be a signal, not a symptom of absence, but an invitation to connection, if you dare to learn. For all couples yearning for revitalized intimacy, Dr. Lauren Pierce invites you to embark upon the full medical journey. Subscribe to her channel and stay engaged for in-depth clinical demonstrations, real-time Q&A with sexual medicine experts, and access to peer-reviewed resources. Try her three-phase neuropelvic strategy. Consider clinical workshops, explore advanced pelvic floor therapies, and share your journey with others. Every story of healing, every tale of transformation strengthens our community because science, compassion, and love together are limitless. Let Dr. Lauren Pierce and the power of modern intimacy medicine guide your path to lasting happiness, fulfillment, and profound connection.